My name is Josh Latimer. This presentation is related to the development and treatment of post-traumatic stress disorder in combat veterans. The objective of this research is to identify variables that increase the risk of post-traumatic stress disorder in combat veterans and which treatment methods prove to be most effective. The first study that will be discussed has a cross-sectional design in which veterans are tested in areas related to mental cognition. This study was performed by Combs et al. To find the effect mild traumatic brain injuries have on veterans' cognitive function when associated with post-traumatic stress disorder. This will be compared to a cross-sectional study done by King et al., meant to determine the effectiveness of mindfulness-based cognitive therapy on combat veterans compared to other treatment methods. The Combs et al. Study utilized random sampling at multiple polytrauma clinics through letters and flyer handouts. The study recruited 438 Operation Iraqi Freedom and Operation Enduring Freedom veterans. Those included in the study must have obtained a mild traumatic brain injury while deployed. Exclusion criteria consisted of multiple psychological tests to determine inaccurate symptom reporting. Participants with mild traumatic brain injuries and post-traumatic stress disorder were compared to a veteran control group, a post-traumatic stress disorder only group, and a group who only sustained mild traumatic brain injuries. The King et al. Study recruited participants from the post-traumatic stress disorder outpatient clinic in the Ann Arbor, Michigan VA Center to clinician referrals. Exclusion criteria for participants were diagnosis of psychosis, substance abuse, or suicidal tendencies. Those included must have sustained combat-related post-traumatic stress disorder while deployed. Participants were placed into 3 treatment groups, which included mindfulness-based therapy, post-traumatic stress disorder psychoeducation and skills, and an imagery rehearsal therapy group. Results were measured using pre- and post-clinician-administered PTSD scale or CAPS, self-report, and post-traumatic cognitive inventory. Combs et al. Found, while those with mild traumatic brain injuries performed worse than the veteran control group, however, those who had both post-traumatic stress disorder and brain injuries sustained on deployment had significantly lower cognitive functioning than all other groups, which allows us to see physiological damage can contribute to the decay of psychological and cognitive functioning. King et al. Found that those enrolled in mindfulness-based cognitive therapy showed significantly better results when looking at the clinician-assessed PTSD scale, as there was a 73% increase compared to 33% in other treatment groups. Similarly, when analyzing self-report and post-traumatic cognitive inventory, those in the mindfulness-based cognitive therapy group reported a decrease in PTSD symptoms more so than those in other groups, showing the benefits of mindfulness-based cognitive therapy has on veterans with PTSD compared to other treatment methods. Internal validity and confounding factors are an important aspect to consider, and I'll touch on their relevance regarding each study. In the King et al. Study, a confounding variable we should note could be the home life and familial support veterans have. As noted in a study done by Elrich and Bayer, good psychological conditions are a protective factor when studying the effects of post-traumatic stress disorder. Because the home life and support system were not considered, this could have impacted study results. The study done by Combs et al. Did well in regards to its internal validity, as there were multiple tests given. They were all the same, and they were given in the same manner to avoid any possible confounding factors. However, when we look closer, it could be argued that a confounding factor is the education level of the participants, as education could play a role in the cognitive functioning to a certain extent. King et al. And Combs et al. Both had external validity and provided samples of population intended. King et al. Recruited only veterans who had PTSD for more than 10 years. This allowed for those who had chronic post-traumatic stress disorder from combat situations to be analyzed. And Combs et al. Specified participants who obtained post-traumatic stress disorder from Operation Iraqi Freedom and Operation Enduring Freedom by referral from clinicians to ensure uniformity across the study. And both studies allow for generalizability to be used specifically for those veterans who sustained post-traumatic stress disorder from their military deployment. These studies can begin to show the effects combat veterans go through physically and how it can impact them mentally. We also see the benefits of certain types of therapy. Understanding brain injuries influence PTSD symptoms and cognitive functioning. It would be safe to say there's a need to know how physiological damage plays a role in the development of PTSD.